Very good. I would like to recognize, put on my glasses, let me see, Mr. Fode Kape from the, can you stand? From the First Lady's office. There you go. Thank you for gracing us with your presence today. And Mr. Adam Khan from the First Lady's office. We appreciate having you all here. Oh, actually, I didn't dance here again. What happened? But I'll sing for you later on. Okay, we're still waiting. The Ministry of Health and the Minister from the Health Department will be here soon. So please give us a few minutes to expect the arrival of this. Anytime now, we should be here. So while we're waiting for them,
We're waiting.
so we have any soft music that can be played?
You what?
Anybody got music here? Or they want me to sing for you? I will sing for you? I will sing for you? No one got to do it to the end, but if you force me, I'll do it to the beginning. Y'all ready for the song? This one, small song, it's a small trail. You got a song here, one star to it. I want you to see the star. You're showing all the people who it. Yeah. Let's see the song. Alright. This song has so much star to it. I sing to it, and why you want to do it in the beginning? Okay, I will try for you. And when you're like it, the person who will be here for like it and a half for surgery. You ready for my song? Yes, go get it. How you going? Okra. They put that baby to go see no I'm going to do it for free. So let me hear you like it for your platform in fact. You ready? I'm coming to see the song now. So the director, all of them sitting down here, like 14 people here. You enjoy my song here. You ready for the song? You ready for my opera? Behind your ashes, so get your chin up, mama. You ready for the song? Yes. Let's go right now. Okay. We're going to start. Is it right after the song will start?
Our Heavenly Father, thank you for this day that you've given us. We thank you for this opportunity for all of us here to gather for this healthcare forum that has been held here in Liberia. We thank you for the organizers and all of those who have labored to put this together, those from far abroad, in the United States and elsewhere, and those here in Liberia. We thank you for the opportunity given us to use this facility here at the Ministerial Complex. We thank the Minister of Health, the Minister, and all the participants here today, all the other organizations that have come to listen to provide information, and to gain knowledge from this conference. We thank you. We hope that the proceedings here will go well, and that everyone will leave here energized.
Am I supposed to pronounce it right? He said, no, I never put a score on you, so I almost going to talk himself. Good morning, thank you. So, one day we'll get the year on it. Sorry for me. Now we have the national anthem. And when we sing the national anthem, everybody please stand. No moving. That's the respect for our country and its anthem. When the national anthem is being sung, nobody moves. So, I think that teacher will get teacher will sing ourselves. Teacher, you have all? No? You ready? Oh, hail Liberia, hail. Oh, hail Liberia, hail. Oh, hail. Yes, Lord, stand of liberty shall long be ours. So you are me, bring me up and I take me home.
The Ministry of recognizes the government alone cannot meet the increasing demand of healthcare delivery. Strategic investment, particularly from the private sector, and our value diaspora, our value expertise, resources, and global exposure remain critical assets in advancing healthcare infrastructure, medical technology, pharmaceutical, and health financing in Liberia. As a ministry, we reaffirm our commitment to creating an enabling environment for investment through accountability, transparency, and policy, while ensuring that all investments align with our national health priorities.
Thank you. Thank you. Thank you so much. I would like to. Hello? 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 Good morning, and I would like to stand on the existing protocol observed. Today is a remarkable day for us in the diaspora as we come here today to discuss, in collaboration with the Ministry of Health, our health sector. As we know, health is wealth, and health is everybody's business. Religion, political belief, economic or social condition, to collaborate with the Ministry of Health, with local organizations on the ground and international organizations as well, from all across the globe. Our diaspora, they are eager, we are excited, the momentum is higher more than ever before for us to join our Ministry of Health, our Minister, Dr. Louis Poto, and other organizations on the ground to come together and collaborate with each other in a cohesive manner to build a resilient healthcare sector. This is why we are here today, and ladies and gentlemen, we look forward to having a fruitful discussion today as we discuss our health sector. There are a lot of gains that have been made, even if we cannot relocate, but whatever little that we can do to invest in our country, this is why we are here today. Thank you.
Let's clap again for Jackie. I want to hear three people clapping. Okay. All right. Thank you, thank you, thank you. Now we have this spoken word performance. Spoken word performance by Ines Garcia. That's how it is.
Good morning, all political observers. My name is Ines Garcia. This piece is untitled. I called home yesterday. My grandma's voice, tired like St. Roof after rain. She said, Ines, I wish hospitals were better here and I didn't have to ride that airplane just for treatment. I laughed. Nervously, of course, because I know she's right. And then I realized that in this country, everybody can afford to fly, right? Well, I left for school, for work, for life. I thought distance was safety. I thought dollars meant armor. But I learned that you cannot buy a working ICU when the lights go out. I think about the last time my neighbor's son was sick, how they ran from clinic to clinic chasing after health like a lost goat. The nurse shook her head and said, no baby, come back tomorrow. Tomorrow? Tomorrow doesn't heal a body screaming tonight. I think about the pregnant women we pass in the hall, faces tight with fear, fingers gripping floors like roots, praying their babies survive the night. I think about the children coughing in the corners, their parents' hands trembling, their eyes asking questions nobody can answer. You never know when it'll be you, lying on the bed, hands trembling, listening to monitors coughing like generators. You never know when it'll be someone you love. Support is not pity. Support is survival. Support is saying, if I leave, my people won't have to fight with empty shells and broken machines. This is not a charity. This is honesty. This is me telling you, you can't be the reason someone wakes up tomorrow, because one day it might be you. One day it might be your brother, your sister, your mother, your child, and if the system fails, you remember the night you did nothing. You remember the night the lights flickering. You remember the empty shelves, how long we waited before we finally decided that it was our problem. Because I often hear people say, we leave Liberia for you. But this Liberia is for all of us. So if you're listening, if you're breathing, if you have dollars, if you have influence, time, don't wait. Don't pray from abroad while emergency waits. Build, support, prepare. Because when the day comes and the bed is yours, and the monitors cough, you'll see fear in your own eyes, reflecting back. You'll know that we should have done better, and we must do better. Thank you.
Thank you, Ines. Thank you. So as Anna said, we have to do better. So we have to get in a plane to go somewhere else. Because my grandmother, when I left Liberia, 21 years old, to go to America, my own plane could never land. But every time a plane is passing over our house, we say, my sister That's very true for our health. So thank you. We now have the state of the health sector by our own self, Minister Louis, Poto, Jackie, okay, and Nadia Green Patrick. That's the state of health sector. Only the minister will be coming. Minister, we need you here. Ladies and gentlemen, our own Minister of Health, Minister Louis Poto.
Thank you. I'll see on the agenda that there's going to be a chat with the minister. Jackie, are we still on for that? If you still want us to have the chat, it's no problem, we can have that. So the young lady who spoke, the spoken word performance, can you kindly come by my side? I'd like to say thank you for vividly letting us know what happened in the past. But currently the reality is completely different in the health sector. Thank you. Distinguished members of the Liberian Diaspora, honorable officials, health professionals, investors, ladies and gentlemen. I bring you warm greetings from the President, His Excellency Joseph and Boyka government and the people in the Republic of Liberia. It is an honor and a privilege to stand before you today at this Diaspora Health Sector Investment Forum, a gathering that reflects not only your enduring connection to home, but your deep commitment to Liberia's future. Today's forum is more than a discussion, it is a call to action. Liberia's health system has struggled a difficult road marked by conflict, Ebola, COVID-19, and long-standing human resource as well as structural challenges. Yet, through resilience, reform, and strong partnerships, our health sector is now on a renewed and positive trajectory. Maternal and child health programs are improving. Currently, we did our data analysis and looking at the number of live births over the number of deliveries. We have done our calculation and we have 159 per 100,000 live births maternal mortality as of now. When we took over, we inherited the last DHS, the maternal mortality of over 600. And I'd like to salute the health workers for drastically reducing the maternal mortality. Our health data systems are becoming more reliable and transparent. As you enter the Ministry of Health, there's a new building on your right that we just inaugurated partially our health data system. In that place, there's on the right wing, you will see a data system where you can see real-time data from the field. You will see where we have high maternal mortality, where we have high neonatal mortality, where we have no referral system, like no ambulance in our district, and where we need to improve health services. I'm proud to say that our data system now more reliable and transparent. Even as you enter the Ministry of Health in the hallway, you will see we have a screen and it rolls over that to see all mucus cases in the country, and it tells us all the malaria cases in the country. transparent and open. When you enter, you see everything about the Ministry of Health, and there are non-identifiable data, aggregated data that we are showing the public what we are doing. Our health infrastructure is expanding. We have sometimes I lost count of the number of infrastructure that we have rehabilitated and the new ones that we are currently building. When I'm asked to give an aggregate number of how many health facilities we have rehabilitated since we took over, I lost count because we are just working, and we are just building and improving service delivery. So our health infrastructure has improved significantly. Most importantly for us at the Ministry of Health, the confidence in our health system is being rebuilt, both nationally and internationally. These things are real, they are measurable, and they are ongoing. We recognize that many in the diaspora regularly ask, what healthcare services are available to us and our families who visit home? I have an aunt, before she came back to Liberia, she asked that particular question almost 10 times. Louis, when I come home, which hospital can I visit? I'm pleased, very pleased, to share that Liberia's secondary and tertiary healthcare capacity has significantly improved, particularly in our major referral institutions and key regional facilities. Currently, services available but not limited to advanced obstetric and neonatal care, specialized surgical services, internal medicine and pediatrics specialty, diagnostic imaging, and management of non-communicable diseases, as well as emergency and critical care services at the JFK Memorial Hospital and other referral centers around the country. I'm also pleased to inform you that we have growing specialist services in visiting residents as well as visiting specialists in our country. Our goal at the MOH is to ensure that Liberians, whether residents at home or abroad, can access dignified, quality health care without having to leave the country. So somebody asked me, which conference are you going to? I told them I'm going to the Diaspora Health Investment Conference in the health sector. They asked me this question: why the diaspora matter? Why the investment matters? And to that person, if you are here today, the Liberian diaspora represents a unique and powerful force. You bring a global expertise, your financial capital, your innovation and best practices, your credibility and trust. Your investment is not just charity, it is nation building with returns. Returns measured not only in financial value, but in life saves, system strengthening and legacy secure. The Ministry of Health, we have identified several high-impact investment areas where diaspora engagement is not only welcome but very, very essential. The first, human capital development. That's our highest priority. At the heart of any resilient health system are skilled, motivated, and well-trained health professionals. Liberia has made significant and important gains, but yet still we have critical gaps, especially in skill, specializing in power. So this is where the Liberian diaspora can come in, and this can be done immediately, and it has a transformative impact. So therefore, we are calling on you to come on board and partner with us in mentorship and skills program, short-term and long-term specialist placement, residency and fellowship support, continuing professional and development and subspecialty training. Many of you have trained and practiced in advanced health system. Your knowledge, experience, and leadership are invaluable. The Ministry of Health stands ready to facilitate overcoming barriers to participation. Two, also critical on our list is medical referral and continuity of care services. That's another critical area of investment. There's opportunities for development of coordinated national referral pathways, teleconsultation, ethical, transparent, and efficient referral partnerships, Diaspora link referral networks, and a strong referral system as we all know saves lives. You can also, the third area of investment, hospital and clinic development. There's a need for diagnostic center. Although we are the president 2 years initiated, we have started a diagnostic center in Balatoa, County, and we intend to have it in all 4 regions, but still there's a need. Maternal and neonatal units and specialized care services. Fourth and very critical, I usually tell any partner that the pharmaceutical and medical supply is very critical. If you do not have a functional pharmaceutical and medical supply, you have a weak health sector. I'm also pleased to inform you that we have, in the various health facilities at the last mile, we have distributed medications, so we have medications everywhere in all our facilities around the country. There is no health facility and there is no medication. He was speaking with our supply chain lead, and he said that because we distribute medications per quarter, and he said for next year, first quarter, I think we should cut down the distribution. I said, no, let's look at the stock, and now we should look, because we have our own supply, where we look at the stock in the various hospital and see where our stock lies. But as we are going to see that we're ready to not have a lot of stock, also we're now going to look at the stock of replenishment. We're not just going to take all the medications into the health facilities as we do. So I'm pleased and very proud that you can go to the last mile and for number 2 compound, and you can even go to number 2, and any health facility you enter, you will see medications. So we have 95% stock in our health facilities from essential medications. So that's another area to invest in. Local drug manufacturing. You could have combination of team and open a local drug manufacturing company. Medical warehousing and distribution. Currently we have only one warehouse, that's a CMS, a Central Medical School. So you could have, combine and have a team and have a medical warehousing and distribution, and also supply chain strengthening. The fifth area of investment is health workforce development. We still have a need for medical training, so medical and nursing training institutions will be open. You will establish a telemedicine specialist outreach. I'm a data, I usually tell my team I'm a data person because I use data to make informed decisions. So digital and data system. So if you want to invest in digital or data system, you can rest assured you have our full support. Health information systems, telehealth platforms, and national data intelligence initiative. We also need partnership in that. Public-private partnerships. As you heard, currently here at the hospital, the government will absorb the salaries of the staff at the hospital because they are too important to fill. So you could have a health facility and work along with the government of Liberia to form a partnership. Once we know there's a need, we'll definitely give you the fullest support. So equipment, there are certain equipment that you can bring in the country, as well as service delivery innovation. We need your innovation. We are there, but we need your innovation to move forward. If you look at the health sector in the last 2 years, somebody told me yesterday I would give people 92%. I told them, no, we're not at 92% yet. We still at 70% because we had to start from a negative number to even come to 70%. And we give God the praise, and also the health workers. I just want to salute them for the level of support they have given to this government, and have become so engrossed in their work that sometimes I visit the health center, the various facilities on the way, and I see the pride in the nurses' faces. Once I enter, the first thing they ask me, because they know that we stress on sanitation. And the first thing we'll ask, because when I walk around, the first question we'll ask, Zach, the place clean? You know, they won't have validation that they're actually doing very well. So actually, the health workers are doing extremely well. Let's give it up for them. I want to take this time to reaffirm the government of Liberia's commitment. Policy reforms that encourage private investment. The Ministry of Health stands ready to work with investors from the concept to implementation. Sometimes those in the Ministry of Health, the employees, they usually say that we are so readily accessible. You do not need an appointment to see any of the ministers at the ministry. You can just go right at the door and we are willing to listen to you once it has to do with the improvement of the health sector. My personal appeal that we want you to partner with us in training programs, introduce technology, share your expertise, mentor our professionals, help us to design a health system that is resilient, inclusive, and future-ready. Distinguished ladies and gentlemen, health is not only a social service, it is an economic foundation, a national security priority, and a moral responsibility. When you invest in Liberia's health sector, you invest in stability, productivity, and our nation's pride. Together, we can ensure that no Liberian is denied here because of geographic, income, or circumstance. Let us transform commitment into capital, specializing in partnerships, into vision, and into action. Thank you for believing in Liberia. Thank you for standing with our health sector, and thank you for investing in us. God bless you. I bless the Republic of Liberia.
Wow, our minister has said it all. Minister, the MC say they give her up. Okay, but our family child not everything. Yes. Yes. Okay.
So we ask So we will take a few questions probably for the next 10 or 15 minutes before I leave. So I will ask Dr. Zia, Yeke, Dr. Yeke, Dr. Portion, and Malaya to come to the stage with me just for 5 minutes.
Thank you so much. Yes. The minister who has said it better, right? Thank you so much. Before the minister can start the chit chat, I just want to say this on behalf of the clinic committee. We want to say thanks to everybody. At this time, we want to let you all know we are not focusing on the wrong things that have happened in the past. At this point, with a health sector that is thriving, we are focused on moving forward and shining a light on the good things we have done. So our minister is ready.
So I will ask Dr. Jua, Kamalu to come probably there will be some surveillance questions. The Liberia Medical and Dental Association President, can you kindly come forward? Dr. Balo, can you kindly come forward? So you have a broad spectrum of specialists on the platform. So we are here to answer your questions.
Okay, so there's another microphone out there. The ministry, up here, this is the entire Ministry of Health, the health sector of Liberia is up here. Let's give it up for them. Let's give it up for the health sector of Liberia. This is your time to ask questions. We will take 5 questions from the audience. So, we got a microphone up there. Okay, Dr. White, I see Dr. White up. Okay, Dr. White first, and then I'll come to you.
Good morning to all of you again. Madam Minister, it was a pleasure to sit here and hear you elaborate on what you all have achieved and what your plans for the country is. My name is Dr. Albert White. I am a 1978 graduate of the AMWLT College of Medicine here in Liberia. I moved to the United States in the early 80s and I've done training and worked there for over 30, 40 years. And I have retired, and I'm also a part of an organization called the Liberia Medical Association USA, and we have a group of over 50 or so physicians in the United States, and we have been very interested in what's happening in Liberia and how we can help in Liberia. I've been taking notes here today, and I see all the things that you have mentioned about the needs that the country has. I will be taking that information back to my organization, and we look forward to working with you all. I see in the program that you all have a representative at the Ministry of Health, Kiana Davis, is that Kenny Davis, who is the Diaspora point person. We look forward to making contact with her and continue to have that communications with you. The list of things that you have put out here today is a broad list. It covers a lot of things, and we don't have to be, like wondering where is this need. I know we have been participating in the medical school, mainly the academic center and all of those places, but we see there are a lot more areas that the need is. And thank you for bringing that to the attention of the group here, and we do look forward to working with you. And I am pleased to see the members of the staff here again, and I will be carrying back a positive report to my organization. Thank you.
So, Dr. Ford, I would just like to recognize you because I heard a lot about you from Professor Foto. He always talks about you. Sometimes he asks me whether I know you, and he encourages us to go out to those that graduated from Turkey. So I'm happy that you're here. I also, you talk about the medical school. There were, I really forgot because, as I said, there are too many things to mention. What we are doing at the Ministry of Health, we are doing a holistic approach to the health sector. We are looking at it holistically. When it comes to human resource development, at the TNI, we currently partner with them where we establish a nurse anesthetic program, because when we talk about, we found out that we had a shortage of nurse anesthetic as well as radiographers. 2 months ago, we brought in over 12 X-ray machines, and the president also brought in, I think, almost 10 X-ray machines. So in this year alone, we are bringing almost over 20 X-ray machines that have to place in the regular facilities. So those X-ray machines need to be there, so we are not training radiographer. There's a radiographer program at the TNI school. We also are working along with a group of retired dentists from India. They also work with the Indian dental school, I think the council. So we want to next year to establish dentistry at the TNI. So we have a dentistry program that eventually may lead to a degree in dentistry at the end of the year. We are partnering with them. We also, because there are a lot of machines, we have distributed a lot of machines, laboratory machines around the country. There's no referral hospital that you go to, you do not see the basic laboratory machines, like the chemistry machines, just nearly they are there. So we want to open a biomedical school at the technician school at the TNI. So those machines can be managed because some of the problems that we have, when you have these machines placed on your spot, you have to bring in technicians into the country. So we've been waiting to hear from you in the expertise that the program is needed. We want to collaborate with you and speak with your friends that graduated from Turkey. I also graduated from Turkey in 2003, and most of us are Turkey graduates. So thank you and nice seeing you.
We have questions from
happened to be one of the products of President Tobo's vision. I was with the first group of Liberians that went to Bermuda to medical school. Came back for a year or so at GFK and went to the States, and I've practiced there since. I'm very happy to have the opportunity to talk with the minister and this distinguished group. I'm very happy also to hear about all the products and the improvements that have been made. I'm a critical care specialist who work with the University of Maryland in the States. I have toured the hospital a few times and I see there's a lot of progress. The one thing I, however, was concerned about was the lack of respiratory therapists. Because one cannot run an ICU with ventilators and not have a therapist. I heard there is some progress being made in that direction. Could you please elaborate? Secondly, I'm with a group called COLED, which is a group of Liberian experts in the States who want to come and help and work back home. And we spoke to you at a conference when you were in the States, and I would like to have a follow-up on that after this meeting at some point. Thank you very much.
So we are health conference in Yasa, so we can be sharing more background. So Dr. Jizu, welcome. We have a lot of other doctors who came from different universities, so we welcome you. Your question was about respiratory care. So that's also a critical area. We recently, I think about 2 weeks ago, brought in a specialist, a Liberian specialist, who came from Ghana. He's an emergency medicine and critical care specialist, and has been assigned to GFK Hospital. Also, we have 2 doctors who's in South Africa who's treating, but we still need your support, and we still need your partnership. I just forgot, Dr. Fortune asked me to inform all of us that we have 9 AI machines. So we're going to AI X-ray machines. 9 X-ray machines of what last week, and they are AI machines. We also said, that we forgot to let them know that the scrub nurses have a scrub nurse program to reduce maternal mortality in these scrub nurses. So we also established a scrub nursing program at the TLIU. So we will stay all day to let you know what we have done, but we just, as I forget, my colleagues will also remind me there are so many things, many things that have been done in the health sector. And that has been translated to the decrease in maternal mortality.
My name is Gally, and I'm with Faith in Action, which is a holistic wellness company. My question here today is regarding mental health in the country, being that it's a huge part of the country recovering. My question is, how are you all putting out efforts for, let's say, consulting, professional services, whether on a city, a county, or a federal level in the country? That's my question.
So your name?
Edna? Yeah.
Edna? Good question. You know, as we spoke, when you talk about federal, we know there is no federal government. But I'm proud, very pleased to present to you someone who has mental health at heart. He thinks mental health, speaks mental health, works mental health. He has made it now to understand mental health. So permit me to give this question to Dr. Zia.
Thank you, Honorable Minister, for giving me a chance. And nice to meet you, Edwards. I know you reached out and we've been chatting. The Ministry of Health has mental health inherent in its national health policy. And then besides that, the service has specific, programs. And I am fortunate at this time to lead the mental health program in Liberia. We have a mental health policy and strategic plan. and that plan clearly signals the need for integrating mental health at every level of the healthcare system. So from community to primary to secondary to tertiary, for us as a country, again, the minister said we are a unitary state, and service provision is spread across the 15 counties through county health systems. So all the interventions we have to provide, we integrate with all other programs, and we are able to pass on service provision at every level of the healthcare system. Indeed, like the minister said, we can always get better. We can always benefit additional support from expertise out of the country, and together we're committed to expanding mental health services. Thank you.
Okay, so I just wanted to let you know, Edris, your question, we are still answering your question. I'm still answering your question. So I just wanted to let you know we have 11 psychiatrists and real psychiatrists in the country, and they are being trained locally. And at the Liberia Hospital, we have a wellness center for our patients where we give them dignified care.
Dr. Poto and the ministry, again, I'd like to thank you for the time that you've taken here today to meet with the diasporans. I am Dr. Carolyn Moore. I'm a cardiothoracic surgeon, Liberian that lives in the U.S. and Western Pennsylvania. And my question is focused on public-private NGO partnership. So what makes a partnership successful from the ministry's perspective, and how can organizations better align with national goals rather than work in silos?
So, Dr. Ho met you this morning, and I have a doctor that is called Dr. Ho. He's Assistant Minister of Curative. He's very professional, very detailed. So when you said Dr. Ho, I was happy to meet you because I think Dr. Ho's are people who are very critical and detail-oriented. So we have a strategic plan. So if you're in line with the ministry's strategic plan, like if you have your clinic and you open and you want to give vaccination, there are the rules and regulations that we have that you have to follow. So go by every unit in the ministry will have our plans that you have to follow to be able to succeed. And sometimes we also come in financially as well as technically to give you the support. You may not know, or even sometimes second staff. If you open a private clinic and you need neonatal clinicians, so you come to the ministry and tell us we'll give you 2 for what period of 2 years. We pay those staff because we are treating Liberians, so you will not allow you to go on your own. Most of the health facilities around have health workers who are secondly there.
Thank you so much.
Good morning, everyone. My name is David Chapman, a student from the School of Pharmacy, College of Health Sciences, University of Liberia. I also want to locate the Ministry of Health. I've been in plan to create a residency program for pharmacists in Liberia. Thank you.
So, probably it will be specific about the gap because I don't know the gap that you are specifically talking about. Secondly, the School of Pharmacy is directed under the University of Liberia. So we will speak with the education minister if there is a need for another level to be added to the School of Pharmacy in Liberia. So maybe you can be specific of the gap you're talking about. I don't understand which gap. But what you could do, because we don't have a dialogue, you could just meet me later since you live here, and you could tell me the gap that you are speaking about.
Thank you.
Thank you. One more question, but there's 5 questions, and then we'll be done.
Hello everyone, and thank you Honorable Minister for having this time to speak to us. Your health taking
system to a preventive first system or prevention first system by strengthening public health institutions, expanding community-based training and health education, and ensuring dedicated, transparent financing for preventive care at county and community levels. That is what I want to know from your end. So,
I think strategy, we have improved communication strategy. So, like for instance, I don't want to say obesity because I stand in front of you. They say, oh, you talk about yourself. But the NCDs, we are now working to ensure that we curb NCDs in the country. So we are doing more prevention. I spoke with somebody yesterday. Should we go and start telling people that we should eat more country rice and put away a lot of starch? So the prevention we've been doing, I think we'll be more preventive in the Ministry of Health from time immemorial as compared to curative. And prevention is better because it's even cheaper as compared to curative services. Recently you saw us giving vaccines, the HPV vaccines, and it was all around. Oh, they want for the young girls not to have and children. That's why they're giving the vaccines. You know, the HPV prevents cervical cancer, and that's preventive. So I went to one of the schools and I was telling a colleague of mine who worked there. So you see with HPV vaccines, as you see with the measles vaccines, and we have introduced the monkeypox vaccines. So I think we are more preventive at the Ministry of Health, and we're trying to shift a little bit to curative.
Thank you. Do you have one last person from here that wants to
have this discussion with you all? Have a blessed day, and my office open at any time for you to see me. I'm very, 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 very.
Thank you so much. This is what she loves to be for everybody's mother. Thank you so much. And as I said, this was the entire health sector. We got picture session of the minister. If you would allow us to take pictures right after the plane to go. Please. So the minister and all her cabinet, I'll say cabinet, I'll call it cabinet. But please come and we'll do a picture and then the minister will leave because she got so much to go let her run after.
Okay, well, let's give the minister and her team another round of applause. Come on, give it up for the minister and the team. The minister says she has a big group.
Yeah, the minister, I have so much to do, so we'll take a picture and then after the picture then.
All right, let's do a picture quick, minister. You got a smile, minister. I know they're trying to drive you crazy. I would say. Y'all please hurry up. Y'all promise all quick. Minister, did not get that.
Members of the Republic and fellow Liberians that have been recognized. The office of the First Lady that is also fully represented by the COS, Chief of Staff, and the Senior Assistant Communications Specialist. I bring you greetings on behalf of Her Excellency Madam Katumo Yata Boyka, First Lady of the Republic of Liberia. She regrets her inability to attend this timely forum in person, but she has asked me to convey a firm commitment to this cause and for complete alignment with the goals of this historic gathering. The First Lady often reflects that her own journey, one marked by survivor, displacement, and dignified return, is a symbol of Liberia's larger story. As someone who has experienced hardship and hope as equal measure, she understands that building a resilient nation begins with restoring the health of its people. That belief lies at the core of her office's mission to inform her message to you today. She also wants me to convey a message to the diaspora to encourage you to return. And she said that I should use my story to encourage you briefly. I live in the United United States for almost 18 years. Went to some of the finest institutions. Got 3 master's degree and a PhD, and have reached the precipice of my career. But I could not feel fulfilled in the United States, and so I had to return. And I have been here for 5 years contributing to this country. And so she asked me to let you all know that the greatest fulfillment is to return and give back to your country. So I should use myself as an example to encourage you to return to this country. Relative to investing in the cooperative driven health system, the First Lady will ask that Liberia stands at a defining moment across our town, villages, and demands for quality health care is urgent. But so too is the opportunity to rebuild our health sector through collective ownership and partnership. Her Excellency believes in a cooperative-driven healthcare model, one that unites local institutions, government, private sector, and the diaspora into a shared architecture of accountability and care. In such a system, she argues that resources are poured for maximum impact. Clinics and hospitals are strengthening with coordinated support. Supply chain are stabilized to ensure essential medical reach every district. And above all, a culture of ownership is fostered where communities become custodians of their own health outcome. This vision does not uphold the theoretical alone. It is practical, achievable, and essential to the kind of national transformation that we were aspiring to. She also wants to talk about the diaspora engagement as a strategic pillar. The Liberian diaspora represents a vast reservoir of technical expertise, financial capital, and strategic influence. Whether through investment, training, or policy advocacy, diaspora engagement is critical to the revitalization of our healthcare workers and health solutions. Introducing emerging technologies in diagnosis and treatment, supporting specialized fields such as oncology, mental health, reproductive care, and pediatric medicine, and contributing to job creation by establishing sustainable health enterprises across the country. She believes that health sector's investment is not solely a public good. It is an economic engine, one that creates dignified employment, reduces drain, and builds local resilience in every country. On behalf of the First Lady, I extend a call to action that is both sincere and urgent. Let us build public-private partnership that reflect shared visions and mutual accountability. Let us strengthen the foundation of human capital by investing in the skills, tools, and systems that sustain long-term health outcomes. Let us connect the commitment of the diaspora with the need of our community through transparent and investable projects. And let us ensure that no Liberian, regardless of location or income, is excluded from the qualified or quality care needed. As Our Excellency has often stated, when healthcare becomes a national priority, every other sector becomes priority. Education, agriculture, industry, and governance. In this same spirit, I admonish you on behalf of Her Excellency by saying, come home not with luggage, but with legacy. Come home not with remittance, but with relationships. Come home not with holidays, but for the harvest. Join us in designing investable projects that meet real needs on the ground. Partner with the First Lady Office in maternal and neonatal currently initiated. The time is now, the nation is ready, the people are waiting, and the momentum is driven and divine. In conclusion, the First Lady is a very religious woman, so her favorite psalm, she would say, "Bless the Lord, O my soul, and forget not all his benefits, who forgives all your iniquities, who heals all your diseases." The healing of Liberia's health sector will require faith, but it also requires framework. It will take strategy as much as spirit, and it will depend on courageous leadership both at home and abroad. On behalf of the First Lady, I commend this forum as a model of what partnerships should look like. Government, diaspora, and private sector coming together in the interest of public health and national growth. The Office of the First Lady stands ready to work with all stakeholders in moving this vision forward. Let us seize this opportunity, not with hesitation, but with resolve. Let us invest in the health of our people. Let us invest in Liberia's future. Let us build a healthier, stronger, more united republic as we all think Liberia, build Liberia, and love Liberia. Thank you so much.
And we clap again, give it up for Dr. Klein and represent the First Lady's office. Now, as Dr. Klein brought to our attention, we forgot to put the First Lady picture in the program. So being that she's our mother, I want everybody in this place to say to our mother, we
2019-2020, Liberia reported a maternal mortality rate or ratio of 742 per 100,000 live birth, and if our newborn data is 37 per 1,000 live birth. Over the period of time, we might not have the opportunity as a country to repeat our Liberia demographic health survey because of fund, but following our DHIS system too at the Ministry of Health, like the Minister emphasized, we have made significant progress over the past 2 years to reducing our maternal mortality ratio to 159 per 100,000 live birth, and the target at the end of the 5 years, we hope we can achieve a target lower than that. Considering our new mortality rate, we are not there yet as a country. We still have challenges to worsen it. But our target is to have at the end of 4 or 5 years from now, 12 per 1,000 live birth. In all attempt from the Ministry of Health, we've been about data when it comes to adolescent health. We know the unmet needs of family planning among married women is still low, especially concerning our adolescent age. Teenage pregnancy rate is still high among our adolescents, but we have made efforts in different areas to improve services. One, for our maternal mortality rate. We think in most of our primary health care facilities, in tertiary facilities, we have equipped our maternal and child health units with the supplies of ultrasounds, patient monitors, and the list goes on. Addressing the issue of our indicators with reference to us having skilled breastfeeding, we have achieved our target over 84%, and now we have 80 and 90% as per our data system of deliveries being performed by skilled breastfeeding. Considering the indicator of our antenatal care visit, trying to achieve our full visit, we have made progress of over 84% of our population having that particular care. And in order to improve that, we are rolling out as a country the integrated pregnant woman and child health program that will not only inform us as healthcare workers, but also caregivers on how to care for pregnancy and our babies. For ratio, we are as a country celebrating our reduction in maternal mortality rate, but the minister is very keen on us putting all effort and focus on reducing our neonatal mortality rate, especially around the perinatal period. So with that, over the past few months, we have procured equipment, especially to upgrade most of our NICUs across the country. We have in 8 counties now upgraded our NICUs and improved neonatal services, training not only doctors, but where there are no doctors, we got our neonatal clinicians and pediatric clinicians that we are conducting online platform to have them trained to be able to care for our babies. We should also admit that we got challenges. But over the past years, as a country, we have made progress and we are determined to do better 2026.
Thank you.
For the adolescents not to be left out, in other counties, we will improve over time, but we are now recording 6 counties that we have different centers in to improve adolescent-friendly services. In most of our schools, we are trying or we have trained female guidance counselors to ensure that they render proper services when it comes to adolescent-related services in school and help us achieve our goals to reducing teenage pregnancy. And at least when needed to have them having access to family commodities through our healthcare facilities. We have also, over time, and try to improve come 2026, our school health programs in different schools, working closely with the Ministry of Education. Thank you.
Thank you.
So we said almost all, so I'll just be very brief. At the county level, I think I was not chosen by mistake. Once arrived being the most populated county, we have the highest disease burden. I think it was one of the reasons I was chosen on this platform. But again, let me just overview that the Bible mentioned about the maternal mortality rate. I'll just give you broad numbers. In Montserrat alone, in 2024, the total maternal death in broad numbers, we had 142. Montserrat, not the entire country, which is very, very high considering our population. And also, in 2024, that has reduced significantly. So, 2025, sorry, as of yesterday. So, we understand frustration sometimes, but again, considering where we were before, definitely we've made some progress. So, maternal mortality has reduced to some extent. We are still making strides to do more. When it comes to cancer prevention, Dr. Kuli had already mentioned, but I'll just tell you what we are doing at the county level. So for Montserrat, we've trained our midwives to do just basic detection of precancerous lesions, WHO approved. The VIA, what we call visual inspection with acidic acid. So on a routine basis, in most of our public facilities, we have trained our midwives to just come, if a patient comes, just put in a speculum and see the service. If there are lesions on the service, that patient will be referred to the next level for advanced treatment. So one of the ways we can prevent cancer is early detection. And again, another way we are doing across the country is immunization. We have the human papillomavirus vaccine in our routine services, and we are immunizing not just in the public facility. Again, we encourage public-private partnership. That is why the Ministry of Health, we have our immunization services not only in the public facilities, we also have immunization services in the private facilities. And those vaccines are being issued to the private facility by the Ministry of Health. We have trained vaccinators. We also gave some on the program for outreach and other things. So just not right alone, we have 412 health facilities, both public and private. You know, the total, we have 60 public facilities. So imagine government alone cannot do everything. That's why we encourage public-private partnership. And of the 412, we also have 173 offering immunization services. So you found out that some of the public facilities, the private facilities are also offering vaccine services. So, I mean, that's some of the things we are doing at the county level. Another thing is, we're still, struggling, I wouldn't say struggling, but we're still trying to improve our family planning services. And I still think there's still room that we can do more. So maybe as the conversation goes on, maybe there are other things that we can discuss, but those are the things that we engage with when it comes to maternal cancer prevention, also adolescent. Thank you.
Okay, thank you for this discussion, and I definitely agree as you follow the previous panelists give you a picture in terms of the scope of what maternal and reproductive health looks like, especially when it comes to something that is apparently new to us, the issue of cancer, and especially the cervical cancer that appears to be in country. And what we've been doing more is the issue of primary prevention in terms of creating awareness that every woman should know what it is when it comes to the risks they stand at. As you may be aware that Liberia has one of the highest fertility rates, we're counting at 4.2 per children per every woman. And the issue of high parity is a very key risk factor in contracting cervical cancer. So the use of family planning services amongst other prevention mentioned, of course, the issue of immunization. And painfully, you heard our Honorable Minister say, we regret that at our age, we didn't have the opportunity to have access to the vaccine, HPV vaccine, which is the #1 causer of cervical cancer. Speaking of the trend, it's been noted that maternal mortality from 2013 DHS, we were counting up to 1,072 women dying because of childbirth. And in 2019, we saw a gradual drop in that number. But then as of 2025, at which time the next DHS who have given us the true picture of what it is after all of the intervention, we can speak to it because all of us are aware of the withdrawal of, donor fundings amongst other things that support the implementation of the DHS. But if you consider our institutional data, we can proudly say we're making significant progress in reducing maternal mortality. And this is not just because of magic, it is the effort that is put in terms of strengthening infrastructure for service delivery, because we don't have all of the manpower in terms of the capable and competent people to be in Bongojile, for example, at our rural or remotest parts of our country. But we do leverage the issue of tax shifting to be able to have access to quality emergency obstetric and newborn care. And one of those groups we depend on key is the introduction and the use of the obstetric clinicians, for example. They've been helping us in places where we cannot have obstetrician or a medical doctor to be fully functional to provide that emergency care. And I will go more towards what policy development has helped us with, because we've reviewed the policy when this government took over. We've reviewed policies. Some of them were okay, and of course, those set on the shelves. We've been able to design new strategy and working on roadmaps that are real time in terms of response to be able to improve the kind of quality we give in. You remember, Dr. Balon noted we have up to 84+% coverage when it comes to skill delivery or facility delivery. Or is the facility or service at the top-notch quality? These are things we are responding to in terms of the kind of policy we structuring, looking at the reproductive, maternal, newborn, child, and adolescent health. A strategic plan for now that we call the investment case. It's one of those we push in, and part of that we have incorporated the issue of community involvement, because all of these things you have to come to the point where you sustain when donor fundings are gone.
Thank you. So in the interest of time, we'll only do 2 more questions. And the next question is for Dr. Balon, Dr. Coley, and Dr. Dickinson. So what are the leading causes of maternal mortality in Liberia, and where are the greatest opportunities to save lives?
Thank you very much. I know over the past few years, reported in our data, we have listed postpartum hemorrhage, hypertensive disorders, maternal sepsis, and unsafe abortion would be the leading causes of maternal mortality. And it doesn't only affect the adult age or our adolescent age, girls are also affected. And I'm sure the data reviewed over the years. We posted once on social media page about what nationwide maternal, perinatal, neonatal surveillance death review. And one of the comments were, you have conducted survey over time, so what's the difference? What we bring to the table after reviewing all the data, learning from different countries, is the aspect of us reviewing those data, identifying the gaps, and making effort to us resolving some of the with other partners. We have tried to develop protocols to address our postpartum hemorrhage, training both nurses and midwives where all they work, trying to strengthen our EMOR services, not only focusing on obstetric or maternal emergencies, but the newborn aspect, since we have a focus on reducing our maternal and newborn mortality. The issue of intrapartum monitoring, we think is very key if we should reduce some of the complications and manage them appropriately. So we have, as a ministry, provided ultrasound machines in facilities where needed, considering high burden areas, and other facilities will follow, not only focusing on hospitals by our primary healthcare level. Looking at the issue of sepsis, the minister mentioned, RPC at all levels, waste management is something very key to us as a ministry, and for that we have established, or at least work with other units. Presently we have our value delivery base, is something that is very key. The issue of hypertensive disorders, we say our magnesium sulfate protocol is something we say instead of. So again, we have made progress as a ministry. We still identify the gap, and there are just so much to do.
Thank you.
Okay, thank you. So I'll just, make some statements on the opportunities to save life instead of the one, because she already mentioned the causes of maternal, some of the causes of maternal mortality in our setting. What are some of the opportunities? What can we do to prevent some of these things? So postpartum hemorrhage and other things. So currently right now, the Ministry of Health has the essential package of health services, and there are different levels of care at the different levels, clinic, health center, and hospitals. Most of our clinics don't run 24 hours. So currently, right now, to reduce some of our maternal death, the maternal child health section of our clinics all across the country run 24 hours. So that if a pregnant woman comes, at 5 p.m., at 6 p.m., at 7 or 8 p.m., she can get the care she needs. That's one. So 24-hour services for maternal and child. That's what we're currently doing. So even though the clinic is a 4 o'clock, or you go to any clinic in Liberia, you'll see the midwife, the NCA section is always open 24 hours. That's one. The next thing is we are upgrading some of our facilities. You know, I'll just say what Monserrat. Monserrat is not just Monrovia. So if you go to Monserrat, you'll find that it is as equal as Greenville. The distances between certain facilities are so huge. You go to it right now, we have a clinic in Contown. There's a time that you have to walk 3 hours in this Monrovia to get to that clinic. So that is one of the things that causes some of this delay. So what the ministry is currently doing is to upgrade some of our facilities in strategic areas. That every district will have a comprehensive health center that, somebody from Toad will not have to be referred to GFK or FAC, will be upgraded to a comprehensive health center where surgical services will be provided. That's one. So, Kingston Health Center, we have TrueLiberia Health Center also will be upgraded. But part of it is that you see GFK is overcrowded and some of our maternal in the peripheral facilities, we can decongest GFK and then GFK can be used for specialized services. So just common cesarean section can be done at Diaspora, at Kingston, at Barnesville Health Center. So that's what we are doing currently to upgrade some of our facilities so that those services can be rendered. So that's the second one. The third thing is expanding our health workforce. So you see, the challenge we have, everybody wants to live in Monrovia. So even with Monserrat, we have an issue with rural Monserrat. Nobody wants to stay in Tony. Nobody wants to stay in, St. Paul. Health workforce, our nurses. Currently, right now for Monserrat, we have over 800 volunteers. And the minister has assured us that those volunteers will be employed and be deployed to those areas where we have had to reach. So you don't have one midwife or two midwives in one facility that are working 24 hours, 7 days a week. So improving the health workforce. And also, lastly, she mentioned one of the causes of maternal death is unsafe abortion. So we want to increase our family planning uptake so that our adolescent girls, unwanted pregnancy is also very high. So we also encouraging, we're working with the Ministry of Education and School Health Program so that some of these messages can be, given to our girls so that it can reduce significantly some of the unintended pregnancies. So those are some of the things that we are doing, and I'll pass it back over to that day.
Thank you. Okay, so in terms of the process being outlined and of course some of the interventions that have been done, I would look more to the issue of the human capital or human development, which is one of the key challenges we have. And you heard right, the minister told us that it is a place we are focusing. We're not just giving professional skills to our care provider, we're also encouraging the issue of behavioral change. We're talking about improved attitude towards patient care, and we want to ensure that respectful care provision for our patients. Another thing that we are doing currently at the Ministry of Health is going beyond the scope that maternal mortality or newborn mortality is an issue of the entire family, and because it means that the family being the nucleus of the community, it sits back on us. So this time, instead of it being discussed as Ministry of Health issue, we want to go beyond and say, can we define a role that we all can follow as a country? Because it is us who are dying, it is our sisters, our wives who are dying. So we are currently working with our development partners, especially the United Nations agencies, to make sure that we have a clear roadmap that will be giving what is sectorial intervention. If you were talking about the issue of referral, timely referral, when a health worker at the primary level has picked up or identified a case, how can they get to the next level of care? So we've been engaging other ministries, line ministries, and agencies about how we can develop a strategic roadmap that will guide services for maternal and newborn services. So that document is almost being complete, and it will interest you to know that the statements, the comments coming from public works, for example, is reassuring. We can tell you that the internal affairs, all of those cultural norms and social norms about husbands being the one making decisions for the health of their wives and causing the primary delay that cause, maternal mortality, those things are coming up amongst the chief and superintendents to be discussed. So there are a whole lot of new approach that can help us improve maternal and newborn health outcomes. So the opportunity is there. You can come and see where you can invest. If we are running 24-hour maternal child health service, we need stable electricity, we need water, and of course renewable energy is one place we are focusing. So it's somewhere you can take advantage of. Thank you.
Thank you. Again, for the interest of time, I'll wrap it up, but I have to say that this talk has been very insightful. We've talked about many themes about prevention, detection, including technology and AI and a path forward. And even with the numbers you gave, the granular data, it may show signs. All I see is signs of progress, and we have room for growth, and I see us really working towards that. So in closing, thank you to our panelists for your thoughtful insights and leadership, and thank you to our audience for your engagement and commitment to the important conversation. Today's discussion reinforces that strengthening reproductive health in Liberia requires continued collaboration across government, health systems, communities, and partnerships both locally and within the diaspora. The perspectives shared here highlight the importance of coordination action, sustained investment, and a shared vision centered on health and dignity of women and girls. We hope this conversation serves not only as a reflection on where we are, but as a catalyst for continued dialogue, partnership, and action moving forward. Thank you all for being a part of this session.
Thank you, Dr. Moore. Thank you. Let's clap again for Dr. Moore. Thank you, Dr. Moore. Okay, we have panel number 2, and that will be for 30 minutes. We're trying to keep up with time. Okay, 30 minutes. Thank you very much. It's Christmas time and people gotta go and do stuff, so we don't want to keep people here long. Thank you very much. My name is Yasa Nlaba, and today I'll be leading a discussion on transforming behavioral health in Liberia, mental health systems, substance use, and trauma recovery. So I will go ahead and call up the panelists. As I call your name, just come up. I will call first my old friend and brother, Dr. Moses Zia. He's the director of the mental health department at the Ministry of Health. Dr. Zia is a psychiatrist and addiction professional, and one of the nation's few psychiatrists. In 2022, Dr. Zia achieved a historic milestone as the first homegrown psychiatrist in Liberia. His journey culminated in his induction as a member by examination of the Liberian College of Physicians and Surgeons, making him the first graduate faculty member of psychiatry of the Liberian College of Physicians and Surgeons. Please give it up for Dr. Zia.
The second person is Julata K. Mulber. Julata K. Mulber. Okay, I don't see Julata in. Julata is a
public health emergency. So looking at what we have as a small country, we have been able to do a lot over the several years, building on strong foundation laid over the years. And as a healthcare system, you can imagine that moving towards efficiency is not done in a year or two, or just instantaneously. It requires years of commitment, years of dedication, but years of focus on what you want to do when you've established that. So as a country, we've been able to do a number of things, and maybe I can bring that at some point in time in the conversation, but I can tell you that we are certainly not where we used to be over the last 2 years or more. We're making significant strides. Thank you.
Thank you very much, Dr. Zia. And Jonathan, you come from a background. So you come from a background where you talk about technology and AI and whatever, and I know you are also passionate about mental health. Can you tell us from your perspective, what do you think our current state of mental health in this country is? Speaking from the background of someone who is in technology, what do you think?
Okay, thank you for that question, and thanks once again everyone for coming. I think it's an eye-opener for all of us to see the state of our country when it comes to our mental health. It gives a really updated data when it comes to the percentage of youth and abusing substance. That's like 20%. And 20% out of 75% of a group of people, that's a huge number. It's over 200,000 to 300,000 people we're talking about. Because 75% between the age of 15 to 24 or 35. So that's a lot of persons. I know everyone in here knows somebody that has a family that is in the street, or a classmate that is in the street that is abusing drugs. So for me, as someone who believes that you can only improve your system through using data, even from a personal level, you have to understand how you carry yourself. So it's a time that the Liberian government has to take a serious step for us to firstly collect tangible data on the situation, because these are data that was collected before. We don't know the validity of those data and how well it was done. So it required us rebuilding our process, collecting proper data to be able to come up with solutions that will help us in the long run. And lastly, I will just conclude by saying our society is kind of prone to mental issues on a lot of levels. We have a lot of stressors, we have a lot of issues, and of course we don't have problems. And unfortunately, everything has become mysterious in where we live, because we don't use science to really define the situation. So it's very important for us to have such conversation from a scientific background. People understand that these things are real health problems. They are not spiritual. It's not somebody wishing for the village. Sometimes people even have their patients at home. So those data is not yet collected. We need proper data collection, and we need practitioners. We need people to be trained in those areas, because it's a huge problem.
Thank you so much, Shulata, and I'm glad because is sitting right there by you. And this is a topic that I'm also passionate about, because I've seen some progress since this government took over. But this question is ready for you. In January 2024, shortly after his inauguration, President Buhari declared drug and substance use a public health emergency to mobilize immediate action resources. Since this declaration and staying here today, what are some actions, steps, and programs being implemented by the Ministry of Health in response to our President's declaration?
Okay, thank you. So the President declared drug and substance abuse as a public health emergency. But what the President did not say, which is inherent, is that mental disorders are comorbidities of substance use disorder and vice versa. So I would like to give just a picture of what the mental health unit has been driving, working with all the other colleagues, all the other agencies. So there are a number of areas we've been making significant gains, and I'll just quickly run through the list. Like we said, we've done a lot, hopefully by God's grace, and we're not able to say all, right? So the first aspect of our work I would like to emphasize is the area of capacity building. Now, like my colleague said, many of us are not educated about many things. That's the truth. But mental disorder is one of those areas that many of us really do not have information. So the way we perceive drug abuse, the way we perceive mental disorders, our understanding is completely different. So capacity building is one of those crucial areas we've been working in. So in the area of capacity building, over the years we've made significant gains, and I'd just like to highlight, for example, that in 2016 we had one psychiatrist in Liberia. Over the last few years today, we can boast that we have up to 11 Liberian psychiatrists. So that's what percentage? Over 1,100% growth, right? So that's one. We now have clinical psychologists around for a long time. And I don't remember when last we had 8, but today we can boast of up to 6 clinical psychologists who are working with us. There are people who have served as our backbone for a long time called mental health clinicians. Those are nurses, midwives, and so forth who were trained through a special program run by the Carter Center. Up to 368 of those people were trained to provide mental health services. So in the midst of the one psychiatrist, they were a major backbone. Today we created a pathway through which these people can advance their career to have master's program. Master's degree level training in advanced practice psychiatric mental health training. So we also go on to provide a lot of trainings in addiction medicine or addiction services. So using the Global Plan Universal Prevention Curriculum that is sponsored by the U.S. Drug Advisory Program, we train over 200 persons in addiction prevention, treatment, and recovery. And until you can have the right set of skills to provide services, you're not able to provide evidence-based services. So those are things we've been doing. Then we use the World Health Organization's model for bridging treatment gap. It's called the Mental Health Gap Action Program. This training, it provides skills, major skills to non-specialist clinicians so that they can provide care to people with mental, neurological, and substance abuse disorders. So we train over 2,000 of these people over the years. So that means, as we're talking about integration, for example, we don't need all the 11 psychiatrists to be in the clinics, but you have people at different levels who are able to screen, identify mental disorders, provide some intervention, and as needed, refer. Next thing we've been doing is service integration. Mental disorders come with significant stigma. So as a way of breaching the stigma, we don't need all the time a specific place to say this place, only mentally ill people can go there. For example, Grand Hospital, which is a tertiary referral hospital, every time you're going to Grand as a patient, everybody knows every time you're going there. So while it is true that we have to maintain the tertiary facility, we are making efforts to integrate mental health care at every level of the healthcare system. And by doing that, we address stigma. Somebody walk into a general hospital, they don't need to know their condition, but they're going to receive care for what they're going for. So we've been able to integrate mental health services in HIV care, in TB care, in neglected tropical diseases care, and so forth. We also being able, like I said, to integrate mental health services at every level, primary, secondary, tertiary. So we are working and training community health workers to identify signs and symptoms of mental disorders and be able to refer to the nearby in the way you will then have the image gap trained personnel to provide initial services. Quickly running through. By this integration, we have been able to, for the first time after many years, ensure that psychotropic medications, and those are the medications we use to treat mental disorders, they are now available around the country. And for many years, they were not available. For many years, we're not available because getting them isn't as easy, but we have ensured that they are available now in our facilities. We also have been making effort on the side of prevention to integrate mental health services at workplaces and in schools. Now we have school-based mental health manual, school-based substance use prevention manual that are being integrated into our national school system so that our young children can understand what mental disorders and substance abuse is all about. On the side of research and data, we've been improving. We've modified and revised our ledgers, our registers to collect accurate data. So after a few years, we're able to make analysis and determine where we are. We also are building a drug information system. We talked about number of people using drug, but if I was to be asked right now, what specific drug is the most prevalent drug people using, we know. So currently, in partnership with the UNODC, we are building a drug information system, and in the next few months, we'll do our first analysis because it started since the beginning of this year. We'll tell you exactly what's the most prevalent drug being used. So as Diaspora, visitors with mental health background, you are able to tell exactly what kind of support will be needed because of what kind of drug we have in Liberia. We also, as a highlight, like to mention that for the first time, we developed a mental health dashboard for the country. And that dashboard gives you information you need to know about mental health. And I can share it afterwards. You just click on, you know where mental health services are, you know where the psychiatrists are, and so forth. And we keep building it, we keep improving that. For policy and regulations, yeah, we have a mental health law, and more recently we developed a mental health regulation that will help to implement the mental health law, because everybody from behavioral health will understand that mental health law and regulation is crucial in protecting the people we are caring for, and so we have that. Of course, we have a mental health policy and strategic plan, which I earlier mentioned. Now we are completing the costing process, so we know how much money is needed for mental health services. But a highlight as it relates to policy and strategic plan is the fact that exactly almost a week ago, a few days ago.
And that will be my next question.
Right, so I'll just get that.
Yeah.
So now, infrastructure-wise, we are improving. It is with great pleasure that I announce that now we're working as a way of integrating mental health services. We're working in major hospitals and health facilities to create what we call wellness clinics or wellness units. Those are like annexes or specific area of service provision of mental, neurological, and substance use disorder services. Then, rehabilitation centers, I know it's one of those areas now we're concerned about. The country doesn't have rehabilitation center now. We have 2 rehabilitation centers or buildings that can house a total of over 350 beneficiaries. Now the renovation process is close to being complete in Bensonville, Benton. And that is something purely for rehabilitation of people with drug use disorders. But the deeper one to that is the fact that many of the people who have been away from Liberia for a long time will know that many years ago we had a facility called the Catherine Mills Rehabilitation Center. That was the only hospital for treating people with mental disorders. It got destroyed during the war, and since then we've not been able to rebuild it. One of the first things we did 2 years ago when this administration took over was to acquire up to 50 acres of land. And now we're in the process of building the first national neuropsychiatric hospital, which is already on hold. Phase 1 of that project is near completion, and we are very, very proud of that. That will be a new rehab for Liberia, which is a bigger facility to manage. And I can go on and on and on. We're talking about drug use disorder, we will have that conversation, and we'll have that topic the next one. Thank you so much.
Thank you so much, Dr. Zia. As I said, we can stay here all day just talking about all the games we made, and we will leave from here. But for the sake of time, should I tell these questions for you? How can technology, we know we are in the age and time where technology is everything and helping us achieve greater and bigger impact. How can technology help bridge a significant gap between the high burden of mental health disorders in Liberia and the limited number of mental health professionals? You from the technology background, so how can we make use of technology to bridge that gap?
So thank you for the question. Thank you, Dr. Zia, for that. I really learned a lot from him about what they are doing, and I'm happy that this comes to reality. We all will benefit from it. So going back to the question about how technology can help, I think we all know that Liberia health sector
there's a huge gap when it comes to professionals and people that need those services. So it's the same for the mental health area. We require tools that require maybe practitioner can be able to have his patients, can connect with them through an app or through non-feature phones. They got platforms like Viamo, where those who don't have smartphones, you can still connect with them with button phones to be able to regularly check on them. Just how we have maternal issue trying to reduce maternal death, you can get doctors check on the patient anywhere they are. So there are systems that can be built like that to keep these practitioners to their patients, even without them coming to the hospital, and also get an information system that keep track on their visits and also understand the type of disease they have. Because with technology, there's a lot we can do. Even with AI, we can even study the prone places, like places that are prone to mental health, or families that are prone to mental health, or county level, or even food consumption, or whatever biogenetic aspect of that can be studied just with AI and other stuff. So there's so much we can do within our space. With the help of technology, we can help with the research. I would just advise the doctor that some of these things should be published so that people can see it. Like if I go out there, I can see what the Liberian government is doing with mental health. And then researchers can also be incentivized to study cases when it comes to the type of mental illness that we're facing in this part of the world. And what are those things that cause us to be prone to it? How can we avoid it? Or how can we mitigate that process? So there's just so much technology can do to better help this particular situation that we have.
Thank you so much, Ugate. I know you also mentioned data. We should try to make use of data because with data we're able to make informed decisions. One question I'm about to ask and then we'll wrap up this session. Because a few days ago, I think it was a week, you launched the 5-year anti-drug action plan. I want you to tell everybody what's in, just a summary, what's in that plan. And I know we have the Diaspora here, we have this thing being live streamed. How can we effectively leverage the unique Diaspora capital, including intellectual, social, and financial resources to address critical workforce challenges, mobilize resources, and get necessary support for not just the 5-year action plan, but Liberia's behavioral healthcare sector as a whole? How can we leverage our Diaspora capital? So it's twofold. A summary of what's in the plan and how we can leverage the Diaspora capital.
Okay, so what's in the plan? Let me first appreciate everyone who worked on this plan. It's a multi-sectoral plan, and it was developed by a committee set up by the president, which includes the Ministry of Health as chair and the Ministry of Justice as co-chair, with a lot of other non-ministries, agencies, and commissions of government, but also includes development partners, civil society organizations, community-based groups, and just the nation in general, because we did a lot of consultation. So what is it? The plan is built on 3 major pillars. So the first pillar is what we call drug demand reduction. The second pillar is drug supply reduction. And the third pillar has to do with governance and coordination. So the first pillar, which has to do with drug demand reduction, has 2 priority areas. The first priority area has to do with prevention and education. So for this area, we want to prevent. And prevention includes preventing the substances from being available, but not just that, educating the potential users who are young people, children, and all of that. So a lot of prevention and education is key, and we are concerned about school-based programs, community-based programs, civic education, working with families, and so forth. The second part has to do with, which is the second priority area, has to do with treatment, harm reduction, rehabilitation, social reintegration. This part has to do with working with those who already have the disorder, how we can get them on the other side. So again, a lot of entities have to collaborate. One of the key areas there has to do with the social reintegration. We know there are multiple factors contribute to addiction. So if we want to reintegrate people, those issues have to be addressed. The issue about employment, the issue about family reconnection, the issue about capacity development for young people to become employable and all of that. So that is priority area number 2. The second strategic is drug supply reduction. The first aspect of that has to do with law enforcement and control. That's the part that the LDEA plays. How do we tighten up our borders so that drugs cannot come into this country? How can we keep surveillance to make sure that people do not transport the precursors and start to produce drugs in our country? So that whole part has to do with the LDEA and the security sector in general. The fourth priority area has to do with the control and regulation of medical controlled substances. And I mentioned this during the launch that the US right now has one of the biggest drug abuse crises in the world. They're struggling, they admit it, they're struggling. And the major drug that is affecting them is opium. And it started because medical practitioners were prescribing opioids, just freely. It became a crisis. We want to prevent that. So as part of the plan, we want to control these medical controlled substances so tightly that we don't lose brain. Then the final priority area in strategic area 2 has to do with legal reforms. How can we modify our laws? What areas need to be changed? What areas need to be modified so that we strengthen the fight? Then the final strategic pillar is governance and coordination. So for this part, we're concerned about the governance structure. And we have 4 levels of governance to ensure that at every level we consider, everyone involved. So we have the multi-sectoral steering committee on drug and substance abuse. That is the highest decision-making body headed by the ministers and the principal deputies. They make final decisions, all right, and tell us the direction that we need to go as a country. The second level is the technical working group where I sit as chair. So this is made of technicians who will now bring up the meat or what do we need to do as a country. Then the third level is the county level. So we'll have the county anti-drug committees. They are like the sub-national representation of the technical working group. They are technicians, but they will drive interventions at the county level. Then the fourth but not the least level is what we call the community anti-drug teams. We want communities, every community in this country to form part of the fight against drugs, being constituted by leadership ranging from the community leadership to traditional leaders to religious leaders to youth and women representatives, including healthcare representatives and so forth, to be able to drive the fight. That is what we have. Alright? And this means that we all are involved in the fight. How can the diaspora collaborate? You can collaborate because you see yourself right in there. You're part of the community. You have the members. You have family members in the community. You have the expertise. You want to treat people. If you have the expertise or experience working in treatment program, you can link with us. We need funding for all of these things to happen. And funding doesn't need to be cash. It needs to be in other forms if possible, resources. You can link us with programs, you can link us with organizations that can provide some of the things we need. Thank you.
Thank you so much, Dr. Ziasa said we could sit here all day and we won't leave. So to end this discussion, and the question is going to the both of you. Looking ahead, Dr. Ziasa first, what is the vision for the long-term impact of diaspora engagement on Liberia's behavioral health landscape? So, Dr. Ziasa you can respond to this question and give your closing statement, and then Jonathan can also respond and give a parting statement.
I think the long-term goal is what is starting now, I would say. By attending this conference and expressing our interest that we want to help Liberia as our home, that is the beginning. We get in touch, we provide updates as to what we are doing, and you let us know how you can help. And with this, we can sustain whatever gains you are making over several years. You can link us with your networks, the working entities that may be interested in the work we do. So I think that is what we're able to do, and we can sustain the collaboration for a long time. So in closing for me, I would like to say thank you for the opportunity to share with you what we are doing in Liberia. We are far from perfect, we are far from the ultimate goal, but I believe that we are on the trajectory to where we desire to be, and together we can get there. Thank you.
Yes, before I close, there are a few things I wanted to say. There is a book called The Economy of Incentives, right? It's very key when it comes to some of these issues. Incentives play a role. That could be either punishment or reward. So I don't know what the policies are when it comes around jobs. Right now, they are enforcement issues that are going around. We got DA bursting things, but I feel it should be built around evidence-based research, and people are trained and are involved in these things. But we really need to rework around certain things when it comes to how some of these jobs issues are handled, because we are talking about the long run. These are big plans, these are good plans, but if it's not sustainable, it does not work too long for us, and we still feel the pinch. So even we talk about America facing some of the worst issue when it comes to jobs, but the data that is passing in those data, there are certain areas that hadn't invested, and there are some contributing factors. So we talk about areas that people are not working. This is where the factory closed before they're moving to China. People lost jobs. So there are contributing factors that come with these things. So we have to be really clear on how we can handle these things. I expect government should be thinking on how they can build Liberian skill set and provide jobs opportunities that will reduce Liberian sitting out of mind and getting involved in substance abuse. And also the environment, we require a clean environment. We don't know how this polluted environment can affect people's mental health and what it can lead to. So we require proper research in this area to really understand what are the correlations and what is leading to these effects and how can we solve it for a longer term. It's good to have big plans, but let it be evidence-based. There's a key case study on Sweden. Sweden faced serious alcohol pandemic after World War II, to the extent that they have a policy that only one store within the municipality that sells alcohol at a certain rate. So some of these measures should be passed. You go everywhere in the community, people abuse alcohol, and these things are road to drug abuse. People, there should be tariff rates on alcohol consumption. We should call it sin tax, where smoking should not be allowed. And every facility that sells this thing, there should be regulation, because if we don't take care, we are going to lose our people. So I will conclude by saying that thanks to the organizing team, and thanks to everyone for coming, thanks to the Ministry of Health and the Mental Health Department for Liberia for the job you're doing, for thinking about the future so that we can continue this problem. Thank you.
Thank you very much.
Let's go.